One of the major challenges has been that there is, for oncologists and referring patients to dermatologists, that there is a considerable lack of access to dermatologists across the country. In fact, only about 8% of patients that develop dermatologic side effects will see a dermatologist at some point during their therapy. And one of the major issues has been the time at which patients can see a dermatologist. And it is important for dermatologists to know that many of these patients need to be seen in a timely fashion, ideally within the same day or within a few days of developing the side effect, or in which the oncologist necessitates the consult, because the oncologist will need to determine whether they can continue with their therapy when a patient develops a dermatologic side effect. It is also very important for the oncologist to communicate with the dermatologist as to what specific therapy the patient is on and how long the patient has been on therapy. Since if a patient develops a severe dermatologic side effect within the first month or two, it is more likely to represent a hypersensitivity or an allergic reaction than if the patient has been on the medication for several months at a time. Also, one of the major challenges that are faced in the communication between oncologists or dermatologists is the grading of dermatologic side effects. And in this case, dermatologists have to be cognizant of the common terminology criteria for adverse events, which is the language that oncologists use to grade adverse events, and will dictate not only management, but whether a patient remains on a certain drug or not. So the oncologist communicating to dermatologists with the duration and the specific type of therapy, saying that a patient is on chemotherapy will not suffice in order to determine the best therapy for these adverse events. And conversely, dermatologists communicating to oncologists with accurate classification of the dermatologic side effect and specific grading according to the common terminology criteria for adverse events.